On this Tuesday night, Canada moves closer to tighter travel restrictions. Concern about contagious new variants prompts new plans.
Nothing is off the table.
And Manitoba puts in tough new quarantine rules as suspected cases of the COVID-19 variant surge in Ontario.
It seems likely that the measures we have in place right now won't be enough.
Plus, a potential new threat to Canada's vaccine supply and sticking to their bubbles. A new, weird way to stage a rock concert.
Global National with Donna Friesen.
Good evening and thanks for joining us. We begin with a staggering new milestone in the pandemic. The world has now surpassed 100 million known cases of the coronavirus, and more than 2.1 million people are known to have died from it. Now, the rise of new, more contagious variants poses a new threat and is prompting tighter travel restrictions. Germany is considering a ban on almost all international air travel. Israel has already done that. The U.S. is banning most visitors from countries where new variants have been detected, including South Africa, Brazil, the U.K., and dozens of European countries. And New Zealand is warning its borders will likely stay closed to visitors for the rest of this year. Today, Prime Minister Justin Trudeau said a number of new measures are being considered here.
When it comes to protecting you and your family, nothing is off the table. We will not hesitate to take even tougher measures if and when they're needed.
Exactly what measures and when they'll be announced is not clear. Manitoba's Premier is not prepared to wait, and today he announced tough new rules for anyone entering that province. Michael Couture has our top story tonight.
To ensure that anyone returning to Manitoba, including Western Canada, must self-isolate for a period of 14 days.
The order applies to all non-essential travel. Premier Brian Pallister believes this is the only way to protect his province against variants of COVID-19, which haven't been detected in Manitoba yet.
Restrictions also have to be brought into place and made real by the federal government, and enforcement has to follow.
And the pleas aren't just political. Dozens of physicians and researchers are calling on the federal government to tighten up the border now.
When we're looking at how quickly these variants are transmitting, doing full restrictions for non-essential travel, I think, is certainly within our playbook.
We are looking at even further restrictions on travel.
While hinting something more is coming, Prime Minister Justin Trudeau points out travel restrictions imposed since the start of the pandemic have helped. According to Canada Border Services Agency, between last March and January of this year, more than 30,000 foreign nationals were denied entry into Canada from the U.S. because it was deemed non-essential. In addition to that, 756 people arriving by air from foreign countries were sent back. But stopping all commercial flights into the country could have consequences.
We know that many commercial flights transporting passengers also carry goods in the belly of those planes. We need to make sure that we are not interrupting our supply line as we strengthen those measures.
Now, those supply lines include the U.S. and Mexico. A U.S. State Department spokesperson tells Global News the three countries are discussing the implementation of science-based protocols along the shared borders. Donna?
Okay, Mike Couture in Ottawa, thanks. More cases of the new variants are being reported every day in Canada, including today, dozens of suspected cases in a care home in Ontario. A growing number of cases have no known link to someone who recently traveled from another country. That's an indication of community spread. Eric Sorensen explains what we know and don't know about the rise of these new variants.
The news could hardly be worse for the Roberta Place long-term care home. More than 200 residents and staff were diagnosed in a rapid outbreak of COVID-19. More than 40 have died. The public health unit at first identified the UK variant in 7 cases. But across the region, it now reports an additional 99 positives for the UK variant, the majority from Roberta Place. The medical officer of health says these preliminary results suggest 2 cases have no known link to the recent outbreak.
Roberta Place had something extraordinarily difficult to deal with just how rapidly this spread through the facilities. It moved very fast. I think that speaks to the nature of this UK variant, that it can do that.
Across the country, COVID variant cases are climbing. British Columbia has detected both UK and South African variants. Modeling by Simon Fraser University researchers shows similar projections for the provinces with the most cases. The new variant in red may come later in Alberta, a little sooner and more aggressively in Ontario. But the national picture is this. The COVID-19 virus may be peaking in January and fall off in February. But the new variant, if it becomes established with a 40% higher transmission rate, will start building in February and could take off in March, hitting numbers of cases far beyond anything we've seen to date.
If you drop something with a high transmission rate into the system, what's it going to do? It's going to grow exponentially. So the thing is, a higher transmission rate means that it seems likely that the measures we have in place right now won't be enough.
One expert says Canadians will have to buckle down, that deterring further travel is one measure, but we must continue social distancing.
What's the most important for the variants is making sure we don't forget about our tried and true principles of infection prevention and control, because these are the things that we know are going to be able to decrease the amount of COVID in the community, variant or not.
There is increasing urgency to get vaccines distributed, especially for long-term care residents. But the persistence of COVID-19 and the rapid growth of the COVID variants will have to be dealt with before large-scale vaccinations can take place. Eric Sorensen, Global News, Toronto.
With vaccines the big focus right now, there's been less talk of rapid testing, but experts say the devices are key in the fight to containing outbreaks. The federal government says it has procured tens of millions of rapid tests, but only a small portion of them are in use. And as Abigail Beeman reports, access depends on where you live.
You got your health card?
Pop-up sites in Nova Scotia.
I thought I would come in and make sure I'm still good.
2 high schools in Montreal, Vancouver's downtown east side, and long-term care homes in places across the country. They all have rapid test pilot programs, but only pilots, months after the first tests were approved. The National Testing and Screening Advisory Panel calls antigen test deployment a priority in a new report.
We need the federal government to procure more of them, we need the federal government to approve more of them, and then we need the provincial governments to support the more rapid use and wide-scale use of them.
Let me just say that we have procured over 40.5 million rapid tests.
But only 15.4 million have actually arrived, the rest to get here by the end of March.
I don't know where this has gone, but rapid testing to me would be an absolute game changer.
As managers and administrators turn their attention to the vaccine rollout, what we've seen in a number of provinces is that testing volumes are going down.
Dr. Irfan Dalla says no one knows for sure why rapid testing hasn't been happening more rapidly, but he points to an overstretched healthcare system with attention on the vaccine and a tendency to prefer a higher quality test, the gold standard PCR lab test.
The antigen test, for all the benefits that it can be quicker and easier and cheaper, the downside is that you do get more false negatives.
And some of the rapid antigen tests do have up to a 30% false negative.
Because of that, antigen tests are recommended for screening purposes in targeted populations, and many provinces require any positive results to be confirmed by a lab.
Everybody wants more. And we are just trying to keep up with demand.
The other type of rapid test uses nucleic acid, closer to PCR in terms of results, but more expensive and complicated than antigen tests. Cepheid's Fluvid test is one of the latest nucleic acid rapid tests approved by Health Canada. It tests for flu as well as COVID.
We're really focusing on sick patients coming into the hospital, where it really matters to have a very sensitive and specific technologies.
Dr. Dave Persing doesn't think Canada is behind in terms of procurement, but he won't give specifics.
So where's Canada on that list in terms of how much we've purchased from you compared to other places?
I don't want to get into that because it'll be a little controversial.
Canada's top doctor says she is hearing about more jurisdictions implementing rapid testing. Theresa Tam says as case numbers fall, it's important rapid testing capacity is in place before restrictions ease. Abigail Beeman, Global News, Ottawa.
There's a potential new hurdle for Canada's vaccine supply. The European Union is threatening to limit exports of COVID-19 doses. Canada's supply of Pfizer-BioNTech vaccines are manufactured in Europe. Today, the Prime Minister said he is working to ensure shipments aren't disrupted.
We will, of course, continue to work closely with our European allies and counterparts to ensure that there are not any disruptions to the Canadian supply chain.
A little later, we'll explain why the EU is threatening to limit vaccine exports. Some help manufacturing vaccines is on the way thanks to a French pharmaceutical giant. Sanofi says it will produce more than 100 million doses of the Pfizer-BioNTech COVID-19 vaccine by the end of the year. The company and its British partner, GlaxoSmithKline, have delayed the launch of their own vaccine to late 2021. One big disadvantage Canada has in the vaccine rollout is a lack of manufacturing in this country. A Canadian pharmaceutical company is hoping to change that. Providence Therapeutics has begun phase 1 of human trials of its vaccine candidate. If it passes all the necessary clinical trials and gets approved for use, the company hopes to produce it in Calgary. Heather Urix-West reports on the Canadian-made vaccine candidate.
Two Canadian companies are hoping this 20,000 square foot facility in Calgary will be manufacturing COVID-19 vaccine by early next year.
Having that capacity in Canada is truly important and for national security and for economic well-being.
The mRNA vaccine developed by Providence Therapeutics has just started phase 1 human trials. The company's CEO, Brad Sorensen, hopes to begin phase 2 by May.
We've got a lot of planning and collaboration that we have to do with Health Canada for our phase 2 and phase 3. And we also expect that there'll be an international component to that phase 3 trial.
Right now, Canada simply does not have capacity to produce the millions of doses needed to protect Canadians from the new coronavirus. The Pfizer, BioNTech, and Moderna vaccines are all produced in other countries. It's why Providence decided to partner with Calgary-based Northern RNA to build manufacturing infrastructure too.
Our phase 1 is we're actually going to be manufacturing some of the components of the vaccine. Phase 2, when we do an expansion of our facility, or actually a restructuring of our facility, which is now going to be much faster than we had previously thought, that's when we're actually going to be manufacturing the vaccine.
Still, even if clinical trials go well, the earliest the Providence vaccine could be ready for final Health Canada approval is next year.
Here's the fundamental problem. Get approval for a vaccine, you have to go through phase 3 trials. And those trials typically enroll some 30,000, 40,000, 50,000 patients. Are you going to find volunteers in those numbers who are willing to try an untested, unproven, unknown vaccine if it means that they must sacrifice getting Pfizer's or Moderna's or somebody else's?
But as new variants of the virus emerge, Sorensen believes the demand for new versions of the COVID-19 vaccine will continue for years to come, and a domestic manufacturing source could ensure Canada always has access to supply. Heather Urix-West, Global News, Calgary.
Some disturbing news from Newfoundland and Labrador. Police have arrested a man who had a large number of knives in his truck outside a political candidate's office. Liberal leader and incumbent Premier Andrew Furey was likely the intended target, according to his spokesperson. Police arrested the man after a high-speed chase that began with the suspect saying he was going to the town of Deer Lake, where Furey is running, to stop the election. An ambitious goal for America coming up, how U.S. President Joe Biden hopes to end racial injustice.
I ran for president because I believe we're in a battle for the soul of this nation. And the simple truth is, our soul will be troubled as long as systemic racism is allowed to persist. We can't eliminate it. It's not going to be overnight. We can't eliminate everything, but it's corrosive, it's destructive, and it's costly. It costs every American.
President Joe Biden setting a new tone for America. He signed 4 executive orders today he says will advance racial equity in America. They target discriminatory housing policies, voting rights, health care, and criminal justice. Biden says it is a step towards healing racial tensions across the country and is the right thing to do, he says, right now because all Americans will be better off for it. This afternoon, President Biden made his first phone call to Russian President Vladimir Putin. The White House says Biden raised a number of issues, including concern about the arrest of opposition leader Alexei Navalny, reports Russia had placed bounties on U.S. soldiers in Afghanistan, and Russian interference in the 2020 election. The former U.S. President Donald Trump was accused by critics of not being forceful enough with Putin. A Russian statement says Putin today congratulated Biden on winning the election, and the two agreed to maintain consistent communication. And Janet Yellen was sworn in today as the first woman to lead the U.S. Treasury in the institution's 232-year history.
Congratulations, Madam Secretary. Congratulations.
Yellen is expected to play a pivotal role in gaining congressional approval of President Joe Biden's $1.9 trillion COVID-19 relief package. A huge cleanup is underway in central Alabama after a tornado ripped through late last night with little notice. It carved a path of destruction 16 kilometers long. A teenage boy was killed and members of his family injured as they huddled in the basement of their home. Dozens of other people were injured too, and a search is underway to find the missing. Ahead, Europe threatens to tighten its grip on vaccines, what it may mean for Canada. There is another potential vaccine hurdle on the horizon for Canada. The European Union is threatening to block exports of vaccines to countries outside Europe, and it's accused AstraZeneca of failing to guarantee the delivery of its vaccine without a valid explanation. All of it a sign the distribution of vaccines is becoming more protectionist and political. Redmond Shannon looks at what it could mean for Canada.
The Oxford University AstraZeneca COVID-19 vaccine has been called a game changer because it's easy to store and it's cheap. It became even more important after Pfizer announced rollout delays with its vaccine. But now AstraZeneca also says it can't meet early delivery commitments to the European Union.
We should remember that what we're trying to do collectively here has never been done in the history of the world, to develop a vaccine or several vaccines in that instance in a year and then scale up to billions of doses.
AstraZeneca says it's a manufacturing issue. The EU is sceptical.
The answers of the company have not been satisfactory so far.
The vaccine was rolled out in the UK just days after Brexit was completed.
The European Union wants to know exactly which doses have been produced where by AstraZeneca so far, and if or to whom they have been delivered.
The EU is threatening to force vaccine companies to reveal where their exports are going.
It is critical to not be dependent on imports. So that AstraZeneca vaccine should be approved. It should be manufactured in Canada.
Tooling up can take time. A vaccine factory is currently under construction at this National Research Council site in Montreal.
We've got good facilities here in Canada, but growing that will be important. I think it'll secure the supply for Canadians and protect against future viruses.
Health Canada is waiting for the EU to approve the AstraZeneca vaccine before it makes its approval decision.
Meanwhile, two German news reports that claim that the AstraZeneca vaccine is less than 10% effective for seniors have been dismissed as completely incorrect by the drugs maker. The German government says the reports are both confused and mixed up. Donna?
Redmond Shannon in London, thanks. Well, if you've got dinosaur fans in your house, here's a story for you. Researchers have discovered a Tyrannosaur hatchling, a cousin of the fierce Tyrannosaurus rex, and they think they know what it looked like and how big it was. The team discovered a jawbone and a claw in Alberta and Montana, the first known fossils of Tyrannosaur embryos. They're more than 70 million years old and reveal the hatchling would have been about 90 centimeters long, about the size of a border collie. Researchers say they would have been the largest hatchlings to ever emerge from eggs and would have looked remarkably like their parents. Next, a BC couple scheme to jump the queue and get vaccinated. There is staying in your bubble, and then there's this. The Flaming Lips put their fans and themselves in plastic bubbles for a concert. The band claims it's safer than going to the supermarket, but medical professionals aren't so sure. Everyone is trying to find a way to manage all the restrictions these days, so the sneaky thing a BC couple did to jump the queue and get vaccinated is getting all kinds of attention. As Robin Gill reports, what they attempted involved a charter flight, a small town, and lots of planning.
Rod Baker comes from a wealthy family. Ekaterina Baker is an aspiring actress. Their story now making headlines around the world, hitting especially hard in the Yukon Times.
From our perspective, we were just completely angry, frustrated with these folks.
The couple's elaborate plot involved flying from Vancouver to Whitehorse, checking into a hotel for a couple of days, then chartering a private jet to Beaver Creek. Beaver Creek is a small border town with only about 100 people. The couple apparently got into line for the vaccine and pretended to be workers at a local motel. No one in Beaver Creek suspected anything until they asked for a ride to the airport. As the Bakers were boarding a flight, officers caught up with them and fined them $2,300 for violating the 14-day quarantine they should have taken upon landing in Yukon. The vaccine was intended for the White River First Nation living in this remote community. The closest hospital is 5 hours away, so Indigenous leaders are outraged.
My first thought was privileged. They're being shamed, good, but that's not enough. I see nothing less than a criminal record for these people.
And keep calm, Dr. Bonnie Henry, British Columbia's public health officer, wasn't so kind with her words.
They should be ashamed of themselves. They put a community at risk for their own benefit, and that to me is appalling.
The thing is, the vaccine requires 2 doses, so a lot of effort went into getting the first one. But what was the plan for the second dose? Guess we'll never know. Robin Gill, Global News, Vancouver.
And that is Global National for this Tuesday. I'm Donna Friesen. Tonight's Your Canada is the municipality of Stewartburn, Manitoba, formed in 1902. There are beautiful spots all over this country. Please email us yours to viewers@globalnational.com. Thanks for watching. Hope to see you here again tomorrow. Take care of yourselves. Bye-bye.